Hello, this is Dr. Evan Hughes. I've been a chiropractor for 14 years, and I want to talk about one of my favorite subjects, which is adjusting children. I've been adjusted by chiropractors since I was 1 year old. It actually saved my life, and I'll tell that story another time. And I have an 8-year-old son who has also been getting chiropractic care, actually since way before me. He got adjusted a few days after he was born. So I want to talk about the process for how you look at children. One of the major underpinnings of setting up a care plan for adults is the x-ray. With kids, we want to try and avoid the x-ray, so we focus a lot on neurological indicators, letting the child's brain tell us how the body is functioning. Things like called the swing test. There are different reflexes. You can look for leg length. You can look at the primitive reflexes, where you will watch the bottom of the foot respond. Making sure that it's the same on the right and the left is our first clue. Looking for muscle tone, right and left. And as a child gets older, you can look at the way that they stand. Adults are good at kind of faking it and being like in the military, versus kids will show you with their posture exactly where you are. Another one is looking for the shape of the cranium and the skull, how the jaw moves. All of these are things that teach us about how a child's body is responding to growing up and the stress in the world. Then, once we have our indicators set, when we know what we're looking for, we go about the process of adjusting them. And then it's all about tone. So if I'm adjusting a weightlifter, for example, I'm coming in with heavy force because they're a heavy person. For an infant, it's very light force because they don't have a lot of muscle tone yet. For kids, they get wiggly. There's some kids that are like adjusting a bag of gerbils. You know what? I have to adapt as a professional. So I follow the kid around. We always end up giggling and laughing and finding the way to address their body. And then the critical part is when you're done having fun with the child, adjusting the child tone to tone, you check your indicators again. See if the nerve system shows clear. Then you know the child is then growing and adapting the best that they possibly can. Kids are fun to take care of for a lot of reasons, but one of the major ones is they respond so quickly. So things that happen in their system, they haven't had years of developing a dysfunctional pattern in scar tissue. They'll let it go quickly, you'll see the results fast, and your kid can go about the business of growing up, which we all know is a lot of work. Things we tend to focus on that usually inspire people into chiropractic care is ear infections, issues with scoliosis, the person might have bedwetting issues, even ADHD are all signs that the nervous system is not at ease and could benefit from chiropractic.